Chronic lymphocytic leukemia is a cancer of the blood cells called B lymphocytes. Today, multiple medications are available for the treatment of chronic lymphocytic leukemia that can be used either individually or in combination to achieve the best therapeutic outcomes. The choice of treatment is based on three fundamental and equally important principles. What is the overall health of the patient, including any concomitant medical conditions and medications? What are the specific characteristics of the abnormal B lymphocytes? What are the patient's preferences? For decades, the only available treatment was chemotherapy, which utilizes anti-cancer drugs. These drugs are taken orally or intravenously. They help manage and reduce the number of the rapidly growing cancer cells. However, anti-cancer drugs are not specifically developed for chronic lymphocytic leukemia. Therefore, they are not as effective as hoped for. Consequently, even though they are frequently used to treat symptoms, they do have significant limitations. Generally, chemotherapy affects not only the malignant cells, but also normal cells of the body, especially cells that multiply rapidly, such as in the hair follicles, the bone marrow, and the mucous membranes of the mouth and gastrointestinal tract. Side effects such as hair loss or nausea are frequent and negatively impact the patient's quality of life. In the last 2 decades, notable progress has been achieved in the treatment of chronic lymphocytic leukemia thanks to the discovery of more specialized treatments. One such treatment uses monoclonal antibodies, which are administered intravenously. Monoclonal antibodies target specific receptors in the same way a key fits a single lock. For example, monoclonal antibodies such as rituximab and obinutuzumab bind to CD20, which is a protein on the surface of B lymphocytes. Thus, they activate the immune system, which in turn attacks and kills the malignant cells. The combination of such monoclonal antibodies against CD20 with one or more chemotherapeutic drugs is called chemoimmunotherapy and has been shown to be more effective than chemotherapy-only treatment. A key feature of the malignant cells in chronic lymphocytic leukemia is that they are stimulated and activated by signals from their environment and live longer than normal B lymphocytes. Targeted therapy comes to address this issue by targeting these two fundamental processes. This therapy includes pills that are taken orally and is gaining ground in the treatment of patients with chronic lymphocytic leukemia. One category of such drugs concerns inhibitors of a protein called BTK. They include drugs such as ibrutinib and acalabrutinib. They inhibit the activation of abnormal B lymphocytes by external stimuli, thus hindering their survival. Venetoclax belongs to a different category of targeted treatment. It inhibits BCL2 protein, which protects cells from dying. The effect of this drug is to lead the malignant B lymphocytes to die. Both BTK inhibitors and venetoclax have proven to be very effective and safe drugs and have revolutionized the treatment of chronic lymphocytic leukemia. However, despite impressive progress, chronic lymphocytic leukemia remains incurable. For this reason, research is ongoing in the search for the best combinations of targeted drugs that will further improve therapeutic outcomes. One thing is for certain. The future holds great promise for patients with chronic lymphocytic leukemia.